Now, Health Minister Dr. Motsoaledi says the National Health Insurance will be implemented. He told MPs during the SONA debate yesterday that several institutions have already been earmarked for the rollout of the project. Now, several civil rights groups and organizations from the health and business industries have criticized the bill, at least in its current form.
Yesterday, during this debate, Mr. Honorable MJ Cuthbert said that he's happy that NHI is no longer in the MDDP, it's off the table. Sorry, sir, it is there, and it ought to be there, and it's going to continue being there. I have listened to people talking about NHI without even having read the Act, and they start by distorting the definition of NHI. NHI, or universal health coverage, is not a new system of health care, as some of you are prone of saying. It is not a system which people implement because they are rich. But NHI is a health care financing system that covers everybody, regardless of their socio-economic status.
Well, let's unpack the story further. Dr. Aslam Dasoo is from the Progressive Health Forum, and he joins us via our video link this afternoon. Dr. Dasoo, let me thank you for your patience and for your time this afternoon. What did you make of the Health Minister's pronouncements in Parliament yesterday?
Oh, more of the same. We've been hearing this story since 2008. It lends nothing, in our view, to the proposals under the NHI, which are unworkable, unimplementable, mired because it's funded by taxes, which we can't raise. It will need massive legislative changes, constitutional changes, which are unlikely to happen. And it's facing a myriad of lawsuits. It's mired. What PHF and its partners in the Universal Health Access Alliance have presented yesterday, and I presume we can talk about that later, is a viable plan based on proper research, proper evidence base, building on what has happened right up until 2007 when it was summarily stopped, and then picking up the pieces that the government has let the public health system fall into because it just ignored it for the last 17 years. And we have a plan that we presented. And so when the minister talks about building new facilities, it's more of the same. The problem for the public sector is its governance. It's not that we can't build new facilities, but how these facilities are built, how they are planned, there's serious difficulty with this. They've built other facilities over this period of time, which have not alleviated the problems in the public sector. So I don't know what they're talking about. And in fact, we're really not interested in what they're planning to do under the guise of NHI.
So I want to get to what you're talking about, Dr. Dasoo, a viable plan. Just tell us more. You said it's something that the Progressive Health Forum and other civic organizations have put together?
Yes, so it's healthcare representative organizations. So it's 54 organizations were at the summit, 30 have signed up to the plan, and more are likely to in the short term. So what this is the entire health sector, the professional health sector, supported even by industry bodies, by patient advocacy groups, and so on. And this is the plan that we've been developing over many years. And now that the president, in October, he asked for proposals after his meeting with Busa, and we submitted it to him. And they, of course, have to go through the various ministries. And the response, unfortunately, at the end of it all, was to say, thank you, noted, your proposals are noted. Regrettably, we can't engage with you because the matter is sub judice. We don't understand that. That NHI is being litigated. This plan is not being litigated. Mm-hmm. And that tells us a whole separate story, that they're not interested in listening to anyone else on this matter. And if you just listen to the myriad voices raising objections to this, even those with vested interests, it's clear that this plan is going nowhere. So what we presented, bearing in mind that there's been 17 years of absolutely no healthcare reform, with a degradation of the public service, reducing access, and explosion of private healthcare, with a static market, therefore prices go up. And even though they could regulate, they didn't do that. Now giving us this health financing model in which all money that is spent on healthcare, private and public, will sit under a fund overseen by a board appointed by the minister in an SOE model. How is that likely to turn out? You know, it's an absurd proposition. What we have here is an integrated, synthesized model that provides universal access to healthcare, which is what we were rolling out before it stopped under the Jacob Zuma administration, who then gave us this uncosted, unresearched NHI proposition, and we had to sit on our hands while the whole system started falling down about their ears. Well, we've picked it up, we've sorted what it will take to get universal access to healthcare for everyone in the country, while utilizing the assets we've got in a reorganized form. And I'll just share this with you. It may make more sense to your viewers. You know, the breakdown in the public health service that this neglect has created has been the subject of much concern, right? We've had Esidimeni, and we've had, you know, those are the high-profile issues. But it's the daily disasters, the serial disasters occurring because of the absolutely irresponsible management of the public health system that has now led to the public health system being beleaguered instead of being the world-class system it was set to become. In the private sector, people complain that the doctors charge 5 times the rate of the medical aid, for example. Lots of people have these questions about how that gets fixed. The plan was always to have a tariff development system that was transparent, that was set, and that the industry would abide by. This plan does that. In fact, the private sector has agreed with this. So it's all come together, but we have just been rebuffed by the government saying it's all sub judice. Their favorite go-to excuse when the questions are too hard for them to answer.
Certainly, it is a favorite one to hide behind, the sub judice rule. And I was going to ask you, Dr. Dasoo, if there is willingness from government to work with health organizations who are actually working in the system and to get proposals from those kinds of people insofar as NHI is concerned. But I suppose you've already answered that question, and the answer is no.
The answer is no. But I'll tell you who they do enlist. They enlist the sweetheart organizations, a couple of them, you know, to promote themselves. They exclude the voices that can help. You know, the plan we presented to the president, if the president had responded, this is a sensible plan, it's implementable right now, it can occur within the current fiscal framework, we don't have to have major legislation, any sensible government should accept it. And if he said, we'll take this on, but it'll be our plan, we would have said, here, it's yours. We wouldn't even want to claim it because the country needs it. Now they've rebuffed us. We are turning to the public. We will be having a series of engagements with public institutions. We want to go to society and say, we are your health workers. We are your health professionals. Your health rands educated us. We account to you. We don't account to anyone else. We are telling you the system is being mismanaged. The problems you are having in healthcare can be resolved this way, but the government won't listen. You need to add your voice to ours. And that's going to be the campaign now. And, you know, we really couldn't be bothered what they plan to do with this NHI, because they actually can't implement it at all. We know that it's mired, and all of the other stuff, making the comment, well, we would be building these hospitals under NHI. No, you wouldn't, because it will be governed differently, and that governance may say we need different kinds of facilities. Unlike the ones that you are promoting right now, which goes out on tender, we don't know who builds them, we don't know what the planning is behind them. And so, you know, we are not going to take responsibility for what this government does. And its obduracy, their absolute stubbornness that they will do this regardless. They made the president sign this act just before the election, thinking the polls are not looking good. Let's sign the act. You know, we tell everyone they can go to any facility for healthcare, as the Premier of Gauteng told rallies, that after the elections, you can go to any hospital, any doctor, and the state will pay for it. What a load of rubbish. They lied. And the polls, the tracking polls, as soon as he signed it, showed a dip instead of a rise. So they should have learned their lesson. No one wants this. It can't work. We've been saying that for years and years and years. And we're not Johnny-come-latelys. We developed the plan in the days of the struggle in the 1980s. It became the 1997 health policy for a post-apartheid South Africa adopted by the first democratic parliament. It was being rolled out. We would have had an integrated system like the one we suggest here by 2012, 2015. But, the politicians had different ideas. And the disasters, people died as a result of that neglect. They have to answer to that first. And putting NHI forward, this will bring equality, it's a sleight of hand. We should not believe it at all.
Yeah, the health minister announcing in Parliament, a number of health facilities that are either under construction or they're undergoing what he describes as revitalization. But he doesn't say much about the existing healthcare facilities, the ones we have, and the governance issues that result in them not operating the way they should, not helping the people that they should.
Sure. And you touched on exactly the important point, the governance issues. So what's happened is that the provinces which have the responsibility to deliver healthcare get their budgets for it. The budgets are controlled by the bureaucracy, unlike what used to happen before when the budgets were managed at the more local level, where accountability could occur. They've also put in sweetheart advisory boards, which have absolutely no power. They've also taken away the authority of health workers, who are trained to optimize the health delivery system, given them to bureaucrats who don't understand healthcare. You've got political officers like MECs who have no knowledge of healthcare, like the one in Gauteng, managing the most complex and comprehensive set of health institutions you'll find anywhere on this continent. And they are managing it like it's a spaza. Our facilities are crumbling.
But also curbing corruption, because the money is there, right?
Right, so much. Everyone's crying now the PEPFAR funding has stopped. South Africa didn't need a cent of this PEPFAR funding. It's 8 billion rand. Chump change when you consider that up to 80 billion can't be accounted for in the health budget annually, just in the public health budget. And then we cry. And projects are now on their last legs because the government didn't step in. They should have. They should have taken these projects. This was well within their capabilities. The projects wouldn't have stopped. People on ARVs would have still been getting their meds in those projects. But we didn't do that. We warned. Trump said this in his first term. He said it again when he got elected last year. We warned. We said, watch this thing. But the government didn't do a thing about it. Now they're sitting there baffled.
Yeah, absolutely. Dr. Dasoo, unfortunately, we're out of time for our discussion, but the NHI, certainly an ongoing discussion that we're going to be having, particularly with the Health Minister's comments in Parliament yesterday. Dr. Aslam Dasoo,